Doctors are shining light on a painful eye problem. Hear about a new approach to treat dry eye in today's medical moment. It's an annoying eye condition that affects more than a quarter of the population. Dry eye forces nearly 23 million people to use drops several times a day. But could light therapy, typically used to smooth the skin, also stop the burning eye condition? As Maureen tells us, patients are going off-label to find relief.
Nancy March hopes this 5-minute procedure fixes her 10-year problem, dry eye.
It really gets painful.
We're seeing more of dry eye for several reasons. I think, first of all, everything from environmental pollutants to ocular surgery such as LASIK.
Ophthalmologist Joseph Ivitar is using intense pulse light therapy, or IPL, to treat dry eye.
The applicator is just put in all along the lid margin. We generally do 2 passes.
The light acts as a warm compress that unplugs glands, allowing tears to flow. It also reduces the inflammation.
So unlike just using supplemental drops, which really doesn't help treat the condition, it just helps, it just helps with symptoms. The light therapy actually helps the cause of the dry eye.
In one study of 100 patients who didn't respond to drops or other treatments, all reported some relief from light therapy, and it lasted for 4 to 6 months. Doctors say patients typically need 4 treatments over the course of a year. Each one costs about $250. Susan Tompkins says that's less than she was paying for the drops she used 6 times a day, which still didn't relieve the problem.
Like you've just come off the beach and somebody kicked sand in your face. And that was really the only feeling, that I had. It's scratchy, they burn, they're red.
She's had 2 light treatments so far.
I began certainly to feel a difference within a few weeks, that I didn't need to be getting up every couple of hours, or every hour to put some drops in.
She can now sit still, focus.
I'm making a tunic sweater.
And finish her cross-stitch without the constant interruption.
It's nice to do and not have to think about my eyes.
With the medical moment, Maureen McFadden, News Center 16.
Doctors say the new therapy works best on people with light skin. After the first 4 treatments, patients typically need to come in for 1 session a year for maintenance. To read the research summary for today's story,